Now, Right to Care South Africa is the first NGO to make COVID-19 vaccinations mandatory for all staff. It announced that all staff, consultants and contractors must get the jab within 6 months of becoming eligible. Its aim is to get over 95% of its employees vaccinated. Let's discuss this now with the NGO's Ntombi, Sigwebela. Thank you very much, Ntombi, for your time. Now, a lot of people would say that this is unfair to make it mandatory for people when the government said you have a choice.
I don't think so, because as Right to Care, we are a healthcare service delivery organization. And as a result of that, we have a responsibility to protect not only our employees, but also the patients that they interact with, as well as their other colleagues that work in the public services where we are. And also the families, it just extends widely. And then we are also not going against the government mandate. The Labour, Department of Labour has put out regulations on how COVID-19 should be handled by employers. And we have followed that regulation to the T. It didn't just come about at a whim. We did extensive, we put a lot of effort into it. We did surveys initially. We constantly provide communication and education to all our staff. During the first vaccination period of healthcare workers, we ensured that all our staff have access to the vaccine sites, and we did whatever it takes to get them there. And most importantly, we are not saying everyone must be vaccinated. If you have a valid reason that's health-related or related to your religion, we are accommodating for you. So there is a process that will be followed for those who are objecting. But science has already proven that vaccines work, and the science is continually improving. Our policy will also improve with science, but we can't let our economy suffer, and also we can't let our health services be compromised when we have a solution. It might not be a permanent solution, but right now, as we speak, this is the only solution that we have. So as Right to Care, we are saying to our employees, we are here, we continue to support you as we have while we were going through the COVID-19 infection waves, by making sure that when you need to go and vaccinate, we provide you transportation, we give you time off work to actually do this and do it holistically.
So how have staff received the news that it's mandatory? Did you, for instance, as Right to Care, have situations where even your healthcare providers didn't take the opportunity when it was opened up to them? And now that you've said it's mandatory, how have they received that mandate now?
It's been, Right to Care is generally a very caring organization. So we have a committee, a COVID-19 committee, that made sure that everyone that got infected or affected by COVID-19 was taken care of. We went to the extent of actually providing whatever was needed. Those who needed oxygen taken to their homes were provided with oxygen. We did the testing out of company funds. We did the follow-up, everything. So this is not a new thing. So I would say that the employees have been aware that this is going to come. As soon as we start, the vaccination program started rolling out, we've been talking about it. And it wasn't just yesterday that everyone got to know that this is mandatory. It's been talked about for the past 3 months. And also the process that we've defined is very clear. If you are objecting, they will assess your risk first and foremost to make sure that you are not exposed and you are not exposing anyone. And then we will go through the process. No one, I guess, because the way management has approached it is in a very accommodating way, we haven't felt yet any resistance. And as we speak, we are already over 80% of our staff are vaccinated. So we are focusing just on the remaining 20%, and we're doing whatever we can to address their concerns, because their fears and concerns are real. But most importantly, we have a program that addresses the myths that are out there in social media and everywhere about the negative effects of vaccines, which are completely false. So I wouldn't say that
there's no resistance.
There's a lot of objection as it is.
Okay.
Yes, yes.